I'm practicing Vapi, southern part of Gujarat, and it is more of the 60% of the tribe area, and it's a high center of the settling part also of India. My study is based on for the discectomy, herniated disc of a single level with a loop versus microscope, where the microscopes are not available. Loops are the microscope common magnification and illumination tools for using in the discectomy. In resource-limited hospitals in rural and urban cities where the microscopes are not readily available, I hypothesize that if properly used, gold and good magnifying loops could offer a comparable result to microscope in relieving radiculopathy, which is the primary goal of the discectomy. With the Association of Spine Surgeon, we have a goal with the safe spine surgery, and if we do, let's do it better to use the microscope with the good gold standard for doing the discectomy if we are doing it with the MLD retracts or the tubes. Prospective cohort study was conducted for the 49 single level lumbar disc prolapse patient with radicular leg pain between January 2017 to March 2021. The microscope used with the ZS OPM PICO, and 15 cases were done with the microscope, and ZS iMac Pro was used for the 34 cases. My exclusive criteria are single level disc prolapse, failed medical treatment and no previous lumbar surgeries, and exclusive criteria are multi-level disc prolapse, previous lumbar surgeries, bony or ligamentous canal stenosis, and when there is a need for the lumbar fusion. Baseline dermographic data is out of 49 patients, whom 15 underwent with microscope and 39 underwent with a loop, operated with the mean age of 38 years, and respectively with the p-value is 0.56. And the 49 patients and 32 were male were operated with 10 with the microscope and 22 with the loop, and 17 were female. Variables are 15 with a microscope with mean severity score of 5 for the microscope and 5 with the loop, and radicular pain approximately 8.3 in both the variables. Duration of the symptoms were according to 3 to 9 weeks or months according to both the criteria. 15 operated under microscope with the disc level were L5 S1 were 51% and L4-5 were 34%, and L1 to L4 was 15%, and 34 operated with under the loop. There was a L5 S1 is 48% and L4-5 was the 48%. MSU classification grades are more were 2 and 3 under the microscope and loop respectively. Disc size 2 were 9 and 20 under the microscope and loop respectively. So length of the incision in a microscope at 2.1 approximately, and in the loop 2.8 with the p-value of significant 0.007, and loop ground with the unilateral muscle separation, and sometimes bilateral muscle separation was needed, and the microscope around 0.011 p-value. There wasn't any statistically significance between the both groups regards the extent of bony work. Technique of a discectomy, p-value is 0.18, and duration of operation is, for the duration of operation also p-value was 0.85. There wasn't any statistically significant between the VAS score of the leg pain and low back pain. Radicular pain recurred in equally portion in both the group. Median leg pain dropped from 9 to 0, and 86% of the patient within 3 months. The WHO has proposed with the work-related musculoskeletal disorder and the rapid upper limb assessment with the angle of a loop and the microscope. There is a dental research paper according to which I'll take 20 seconds more, according to which there is a considerable radicular upper limb pain provide the risk estimated with the musculoskeletal disorder. We found that the naked eye medical loops intervention, there is a high risk conferring the result, while the surgical microscope, the total risk classified as a low. Estimated risk of musculoskeletal disorder differ in the visual aids, pointing out that using surgical microscope is less fatigue, and the medical loops are or a naked eye. There is a one paper which published with a cervical disease, degenerative disease in a surgeon with a loop with a high, with headlights. And this would be the, if this could be a neck angle, according to this paper, you are giving, you are actually giving approximately 22 to 27 kg at your cervical disc. So conclusion, operative microscope and loop are both acceptable alternative tool in lumbar discectomy. In rural and urban cities, hospital is less resources and less access to the microscope and minimally invasive equipment such as endoscope, MLD system when for the microdiscectomy. Loop are safe and effective tool for the lumbar discectomy. Operating microscope is always a surgeon friendly and give a good viewing angle without a musculoskeletal disorder, work related. Thank you.